There are some cancers, for example, pancreatic, lung, and even brain, that are not detected early enough to be able to save the person's life. And these are three very, very bad cancers. If you can detect it early, you can save the person's life.
Welcome to Believe in Progress, the American Association for Cancer Research Foundation podcast. Join us and be inspired by the incredible stories of those who have faced cancer with strength and resilience, and the medical professionals who are working tirelessly to find new treatments and ultimately a cure. Believe in Progress isn't just about the science of cancer. It's about the human side of this disease. Together, we can make progress in the fight against cancer and bring hope to those who need it most. Welcome to the Believe in Progress podcast featuring Dr. Margaret Foti, who is joining us here at the AACR headquarters in Philadelphia. Dr. Margaret Foti is the Chief Executive Officer of the AACR. Under her visionary leadership, the AACR's membership has grown from about 3,000 members to over 54,000 in 130 countries and territories. She also helped increase the AACR's portfolio of peer-reviewed scientific journals from 1 to 10. After beginning her AACR career in an editorial position with the Journal of Cancer Research, Dr. Foti progressed through several key editorial and management roles in scientific publishing to become the AACR's Chief Executive Officer. She launched 9 additional major peer-reviewed scientific journals. She also helped launch Cancer Today, a magazine for cancer patients, survivors, and their families and caregivers. Dr. Foti is a proud graduate of Temple University and one of the most influential voices in advancing the field of cancer research, both in the United States and abroad. She was elected president of 3 professional societies in scholarly publishing and in cancer research. She has also served as a board member, committee member, and consultant to a number of other nonprofit organizations. Under Dr. Foti's leadership, the AACR has served with distinction as the scientific partner of Stand Up to Cancer. In this capacity, Dr. Foti and the AACR staff have brought significant expertise to their work with Stand Up to Cancer, especially in the scientific peer review of projects, scientific project management, grants administration, communications, and science policy. In 2019, she was honored as one of the Women of Inspiration and Influence by the Women Business Leaders of the U.S. Healthcare Industry Foundation. She was also recognized with the 2018 Women for Oncology Award from the European Society for Medical Oncology. In 2007, the AACR established the first AACR Margaret Foti Award for Leadership and Extraordinary Achievements in Cancer Research, which is given annually in her name. Her visionary leadership, combined with her steadfast focus on the AACR's mission, continues to drive the field forward towards the vital goal of preventing and curing all cancers. Well, Dr. Foti, I can't tell you how excited I am for this podcast today. Welcome to Believe in Progress. I'm so excited to have you here and be part of our show. You are the Chief Executive Officer of the American Association for Cancer Research, an organization that I'm immensely proud to work with and work with you. Just so happy to have you here today. Thank you for joining us.
Well, thank you, Mitch. It's really great to be with you here and knowing that you are making great strides here as the Chief Philanthropic Officer of the AACR Foundation.
Well, thank you. Thank you, Marge. So, Marge, I know this because I've known you for a number of years. You grew up in Philadelphia. Can you tell us a little bit about your roots? You grew up in South Philly, I believe.
That's right. I was born and raised in South Philadelphia, where a lot of little Italian girls grew up, and my parents were first generation in this country, and it's exciting to see what the Italian community has been able to do for all of us in this country. My grandparents were very excited to work with us and be with us, and my grandfather in particular liked the fact that I could play the accordion, which reminded him of the old country.
So did they teach you that? You taught that? You took lessons for the accordion?
I took lessons for a long time, yes.
You still play?
No, but I did have some exciting moments playing for the mayor and some
really?
other. Yes, it was really thrilling.
Which mayor?
Mayor Dilworth, and also for the USO, and and for the Italian consul. So it was really a special moment in my life.
That's really cool. And you went to university here in Philadelphia as well?
Yes, I'm a graduate of Temple University. I have several degrees from Temple now, and I'm very, very proud of what they're doing. And I work with them all the time to do even more there, so in communications in particular.
So you have a storied career. You're a wonderful leader, and I'm really curious about how you got started in cancer, in the field of cancer, if you will. I don't think that's how you first sought out a career, but I'm just kind of curious what the progression was and how you kind of moved into a role at AACR.
Well, thank you for asking. It was certainly accidental for me. When I first graduated from St. Maria Goretti High School in South Philly, I really didn't know what I wanted to do from a career standpoint. And my mother was very anxious that I would go to university, but I wasn't really sure yet what I wanted to do with my career. So she insisted that I go to the University of Pennsylvania to work there so that I could go to school at night. So my first job was to work at the University of Pennsylvania Moore School of Electrical Engineering, where I met a number of computer scientists who were at the top of their field. They had come from the computing lab at Harvard, and it was very exciting to be with them and to see their excitement about their work. And so I, as a young person, I led a department of 13 graduate students and 5 faculty members and my boss. And I observed how excited scientists can get, irrespective of their field, about discoveries. So from there, I started taking courses at night at university, both in business but also political science, and I fancied myself at being an attorney at that juncture. But after I got to the top of my classification at the University of Pennsylvania, I decided I would look at other opportunities, and I applied for an editorial position at the AACR as an editorial assistant for the journal, the flagship journal of AACR called Cancer Research. And I got the job. I didn't have my degree yet, and I was happy to do it, but they liked the fact that I had done a lot of editing at Moore School.
What caught your attention to even apply for that job? What got your,
Well, it was the advertisement actually was very compelling. It talked about how important cancer research is, and that motivated me to apply. And of course, I liked editing, and I thought I could do it. And the editor-in-chief at that time, whose name was Dr. Michael Shimkin, who had been the prior NCI director, felt that I could do the job, and he was very encouraging. And there it was. I was editorial assistant for 4 years, and then I was made managing editor at the age of 24. Couldn't believe that.
You still going to school at the time?
Yes, wow. I was still going to school at night. I did all my work, my university courses at night. And then about a decade later, they asked me to be the first CEO of the AACR, and I was stunned but thrilled and humbled
right.
to take the position.
And what was the size of the AACR at that time when you were just becoming the first CEO?
We had 3,000 members in maybe 10, 15 countries. And now we have over 54,000 members in 131 countries.
Amazing.
It was much smaller then, and not as much work. Now we have a lot of work to do.
Round the clock, right?
Yes, sir. Yes, sir.
I know you've had some personal experiences with cancer. You also do a heck of a lot of work, on some off hours as a patient navigator. If you don't mind, would you tell people about how cancer has, touched you and your family personally, and then maybe touch a little bit on the patient navigation in your eyes, why that's so important, and why you take that on as much as you do?
Well, to be honest, although I had been working in the field for a while, we had never really been exposed to cancer in our family to any great extent. There may have been long-distance cousins we didn't really see. But for the most part, I had not seen it directly in my family. And when my sister was diagnosed with late-stage ovarian cancer, it was pretty shocking to me and something that really had an amazing impact on me. I could see the devastation of the disease, the difficulties she had with the treatments, but she was a tough person and she got through it. Now this year she's celebrating her 25th anniversary of being cancer-free.
That's great.
And so that really was thrilling for me to watch. And I must say that it's all due to cancer research and the breakthroughs and the therapeutics that they had available even at that time that allowed her to be cured. Of course, she's not. She was lucky, but we already now have a cousin of mine who has pancreatic cancer, who's struggling with that, younger than I am. And so there's so much more work to be done in this field, and that's what motivates us to work very hard to try to.
So people call on you all the time to help them and counsel them and give them ideas. Again, patient navigation.
Yes.
Could you tell our audience a little bit about your own role with patient navigation, but the importance of patient navigation as well?
Yes, well, it's something that we're doing increasingly. Previously, we had not done as much, but now we see the value. And certainly, as the CEO of this organization, I myself feel very strongly there's a responsibility to respond to an inquiry from patients asking, well, what kind of clinical trials can I get into? Where can I get the best care for a particular cancer that they're facing? And so I'm doing a lot of this now, and I think going forward, we're seriously considering having a website so that we can do more. But most importantly, we're saving one life at a time, which is really very thrilling for me.
Right. Is there any particular story that you can reflect on of patient navigation, or anybody that you've helped and because of your help and counsel, they're thriving now?
Well, the one I can recall is that of a friend whose aunt was very sick, serious breast cancer. There are multiple types of breast cancer, and so we had to make sure that she got to the right oncologist who knew something about that particular type of breast cancer. So she's living today, and I'm thrilled that I had a role in it, a minor role, of course.
That's fantastic. Let's chat about AACR for a minute or two. The AACR annual meeting is the flagship event for this organization. But it was a much smaller meeting 20 years ago, 25 years ago to what it is today. Talk about the significance of this unbelievable scientific meeting and what it means to the field at large.
Well, the annual meeting is the centerpiece of everything we're doing in cancer research, both nationally and internationally. We have, when you think about the fact that we now have maybe 22,000 attendees, but about a third of them are from outside the U.S. So it's a global activity that really serves the needs of not only the senior people who need to be together, and hundreds of presentations, but also it serves the needs of the junior scientists who want to present their latest results in poster sessions, and we receive thousands of those abstracts for presentations. So it's a huge activity. Years ago, when I was first starting, we could actually fit into a hotel.
Really? One hotel?
Yes. And there were maybe 1,000, attendees. And now we take over a whole city and large convention centers. So there are multiple sessions going on, hundreds of presentations, plenary sessions. One very important thing that we're growing is plenary sessions that are presenting very cutting-edge clinical trials. And then we show the science behind those trials, because obviously one of the benefits of the AACR is that we cover all the sciences, going from laboratory all the way to the clinic. So when we present a major breakthrough, we can talk about exactly what went into that scientifically in order to deliver that breakthrough to the patient. So all that happens at the annual meeting, and I'm thrilled to be able to oversee it. always. It's now 5 days long, with many educational sessions as well as major sessions.
And next year, our annual meeting is going to be in San Diego.
Yes.
And we think we'll surpass 22,000 people.
Absolutely.
And it'll be, again, a remarkable meeting. And we move our meetings around every year. Is that correct?
That's correct. Right now, there are maybe 7 or 8 cities in the country that can accommodate our large meeting, and we try to diversify those venues. And so next time is in San Diego.
And related to the annual meeting, talk about the volunteerism that really makes the meeting go. You know, the spirit of the scientists that are really volunteering their time to make this event so spectacular.
What I think what is very interesting for me to observe is the fact that whenever we ask prominent scientists, let's say, whether it be someone in the laboratory or the clinic, they always say yes to serve, whether they be advisors in the scientific content that is being presented at the meeting, or they're helping with education training of young investigators. There's an enormous interest to help the AACR, and we're very pleased and very happy that we have such a constituency of interested individuals who are so dedicated to the field and dedicated to helping the AACR bring all that about. So I think volunteerism we couldn't do without it, actually, and every year we have about 1,000 volunteers on various committees that work to advance certain areas of the field.
That's amazing. And these are dedicated scientists that are working around the clock already, right? And they're
Absolutely.
giving us that much more of their time. You know, you've told me that in the past you think the AACR has played such a pivotal role in the careers of many of these scientists and doctors. Could you explain that a little bit?
Well, I think in so many ways. First of all, if you give young investigators a chance to give a presentation at a meeting where there are hundreds, if not thousands, of people in the audience, that alone catapults a career, gets their name out there. People see that. They have job opportunities if someone is in the audience who's interested in that particular area of cancer research. Mm-hmm. So the presentation is important, of course. The other thing that's equally important, and perhaps even more important, is our ability to get research grants to individuals who are doing great work. And of course, your work as the Chief Philanthropic Officer is very important in that regard, to raise funds and be able to fund the best science, whether it be for senior, but even more importantly, junior investigators who need to have grants early in their career. And what we've seen now is with those research grants, 10, 15 years later, they're full professors and they're working in various sectors of the field, whether it be academia, industry, philanthropic organizations. They're just doing fabulous work later on in life. And we're very proud that we've started that early on.
And in the words of one of our past presidents, Dr. Caligiuri, no money, no mission. And there's a lot of truth to that statement. And philanthropy does play an important role in the AACR and in cancer research in general. We really appreciate your support. I've been here 10 years now, and the foundation started about 22 years ago because of your vision and Dr. Clarkson's vision. Do you remember discussions with Dr. Clarkson about why the foundation should start?
Yes, I certainly do. By the way, Dr. Clarkson next month is having his 97th birthday.
I heard. Yeah.
And he still cares about us and calls and wants to know what we're doing and is supportive and thrilled about what you're accomplishing. Yes, it's very, very important to raise funds for cancer research, for research grants, as I said, for various fields that really need support. But even more importantly, right now, the federal government is leveling off and, in fact, lowering its contributions to medical research, and philanthropic dollars become even more important to the community in order to be able to keep the research going. So I can only say that our role, and even at back then in the beginning of the century, but also now it's become even more important in order to be able to fund research and avoid these young people leaving the field because they're not getting grants. So right now, about 11%, sadly, only 11% of the meritorious grant applications are funded, but people are worried that will go down below 11%, maybe 7 or 8% in the next couple of years. It's outrageous, really, that we can only do that. And so think about all the great ideas that either both junior and senior investigators have that are going unfunded. And so we don't want to lose the young people who are interested in cancer research. I didn't mention the fact that 54% of our membership is in the young investigator category, and another 4% are high school and undergraduate students.
Right.
So there's a large cohort of individuals in our membership who really want to stay in the field, but if they can't get funding and they can't get jobs, they will leave to go to other opportunities, and that would be very unfortunate for cancer patients.
It's our responsibility to make sure that doesn't happen, right? I mean,
Absolutely.
That's what we're really. That's what we really have to work hard to make sure that doesn't happen. I remember this past annual meeting. I was at one of the events, and the young scientists, just came up to me and thanked us for either research grant awards or scholar and training awards, and it was so gratifying. And it really kind of puts your job into perspective, how important it is. The work we do. Dr. Foti also is she puts her money where her mouth is, and she supports the organization big time. But she also gives money to these scholar and training awards. Could you just chat a little bit about why that's important, do you think?
Well, Scholar and Training Awards are really travel awards to come to our important meetings. Now, meetings stopped during the pandemic, and it was very sad because a lot of people were really feeling that they were not getting the information about cancer research as actively as they used to. And in the hallways of meetings, particularly the annual meeting, accidental opportunities come along where someone might mention an interesting idea about how to, let's say, cure a particular type of cancer, and that really stimulates a new idea. So when you think about it, innovation is happening at the annual meeting, and you must get young people to be able to come to the meeting. So being able to raise the funds to be able to bring those young people to the meeting and have them interact with the most senior of colleagues is absolutely essential for advances in cancer research.
Well, thank you so much for your support of that. I really appreciate it. You mentioned COVID, and I must say that was a really challenging time for the organization. And as the chief executive officer, you really had to navigate a number of issues, including an annual meeting. Can you talk a little bit about the challenges of that period, and then maybe even go on and talk a little bit about the challenges to the research community at large? And I think we're still making up for lost time there.
Well, of course, we had to cancel our meeting with only 6 weeks' notice, which was very sad, actually. And and when you think about the importance of the annual meeting, you have to think about how people were calling me crying that they could no longer come to the annual meeting in person. And so for several years, obviously, we had to do this remotely, online. Of course, Zoom helps, but it doesn't help that accidental finding that I was talking about. And so we struggled through the pandemic period. Now we're so happy to be back together, and I think we'll feel really good moving forward with our meetings in person. And 92% of the people who attended our 2023 meeting came in person.
Right.
So it's clear that people want to be together. The others were at home and were not happy,
Right.
in my view. But even when you think about the effect of COVID on research, I mean, there have been situations where clinical trials have not been able to be activated because of personnel not being able to be in the facilities. And although there are new things like telehealth that have come along to help with that, it's not the same. And so there are still negative aspects of the pandemic that we're dealing with. But overall, it's been impressive that we've been able to somehow weather the storm, and we're back to a reasonable status now.
So there's been some amazing breakthroughs in cancer research. What do you think? What do you think is the future look like? It certainly seems promising. I'm a layperson, but from your perspective, can you tell the audience a little bit about what your thoughts are, where the next breakthroughs are going to come from, and where do you think we're going to go from here?
Well, I think first of all, there's been an enormous understanding of cancer biology that has really led us to be able to do what is called precision oncology. And so now we know how to target the particular mutation in the tumor and apply the appropriate therapeutic to that tumor to be able to save the person's life. So precision oncology is extremely active now in the field, and it's something that I think will continue to flourish. We have meetings on that every year, not only in the U.S., but also in Asia, in Korea, and in Japan, and elsewhere. So I think that moving forward, we'll see this even become even more prominent. Immunotherapy is a very exciting new field that we are seeing now advancing very rapidly. There's something called a checkpoint inhibitor that literally releases the brakes on T cells that are cancer-fighting cells and allows the therapeutic to become active and cure the patient. And so there's been enormous advances in that area and continuing so. In 2011, for example, there was only one checkpoint inhibitor approved by the FDA, and in 2022, there were 9. So you can see this acceleration of advances in that field alone. And then there's something called liquid biopsies, which is really something, of course, that President Biden has been talking about, early detection. Very, very important to detect the cancer early in order to be able to save the person's life. And liquid biopsies are being studied very, very rapidly. There's a whole group of about 50 different institutions in Europe that are focused on liquid biopsies only to really be able to detect the cancer in the blood without having to do invasive biopsies. And so that, along with other early detection methodologies, is really moving very rapidly in terms of helping the field. Other new technologies like artificial intelligence and something called CRISPR, things of that nature are really moving forward. I just got back from a meeting in Trento, Italy, where for 3 days they talked about new technologies for studying and treating cancer. An enormously exciting conference led by a Nobel laureate, a member of AACR, Dr. Bill Kalin, and I came out of that conference filled with excitement about the opportunities in new technologies. And then, of course, identifying risk factors. We know now that, of course, we've always known that tobacco is a very bad carcinogen, but also alcohol, poor diet, obesity, being responsible for 15 different cancers. Mm-hmm. These are things we're tracking very carefully so as to do more in cancer prevention.
You mentioned somebody in your family is dealing with pancreatic cancer. And I know early detection is a really big thing for us at the AACR to continue to be involved with. Can you talk a little bit about the importance of early detection?
Absolutely. I mean, there are some cancers, for example, pancreatic, lung, and even brain, that are not detected early enough to be able to save the person's life. And these are 3 very, very bad cancers that if you can detect it early, you can save the person's life. So early detection, whatever the methodology, is going to be very important to saving more lives from cancer. Look, we've done a lot in progress against cancer. There's been a 32% reduction in the cancer death rate since 1991. And we're very proud of that. But there are, after all, over 200 different cancers and thousands of subtypes.
Right.
And so we need to understand what actually starts these cancers, what causes them, how we can catch it early so that we can save the person's life, and early detection is absolutely essential.
So Marge, you talked about high school students and undergraduate students, and what kind of advice would you give young people that might be seeking a career in the cancer field?
Well, I think for one thing, one should talk to one's advisors early on to be able to try to see whether the field is really what one might be interested in. I think what is interesting to me is that young people, whether they're studying biology, chemistry, physics, or even an allied field, really can get exposed to cancer research and its potential. I hope that people will look to the AACR for opportunities in early education training, so that they can, test this out and see whether cancer research is where they want to go, because obviously the workforce going forward is going to be very, very important. And we need funding not only for their grants, but we also need funding for educational events that we would hold to be able to bring them in, teach them a little bit about the field, and I know once they get exposed, they'll be hooked, actually.
We as an organization are dealing with some issues with health disparities, and we also we have a program called Women in Cancer Research and Minorities in Cancer Research. I know you and I are both very proud of those programs. Just curious, when you first became a CEO and kind of working your way up the ladder, was it hard being a woman and being a chief executive officer of probably a male-dominated board and organization?
Well, interesting question, Mitch. Well, I think I was frankly very surprised that within AACR I never had very much discrimination. In fact, I was in my 30s and I was asked to lead the most important cancer research organization in the world.
Right.
That to me was already, a validation of the fact that they were going to give me a chance. And these were largely very senior male scientists who were
Right.
making this decision. However, I know that other women did not have similar opportunities. Now, on the outside, I remember going to a conference which had a CEO session only, and I walked in. I was the only female in the room, and the speaker announced to please ask anyone in the room who was not a CEO to leave, and he looked at me. And I realized that...
How dare that guy?
I realized that he thought I had wandered into the wrong room. So on the outside there were, and I guess there are continued discriminations going on. But I'm very proud in the AACR that we've had the Women in Cancer Research Council, and with thousands and thousands of women as members. And we actually received an award a few years ago for being the best organization in having women leaders at our board level and other leadership levels, more than any other cancer organization that was studied. So I was very proud of that, and we showed that 50% of the individuals on our boards were women, and so that was really very exciting.
Could you just chat a little bit about, we're both, again, very proud of our cancer progress report and our cancer progress report for health disparities as well. These are tremendous publications that we get involved with, but could you talk a little more about the importance of those two documents, if you will?
Well, of course, diversity, equity, inclusion is very, very important to us. and increasingly so. And obviously, not only from the point of view of making sure that we give grants to talented individuals who are minorities, but also other ways that we can train them to help the field. For example, we have one project called Bristol Myers Squibb Foundation Robert A. Wynn program that really teaches minority clinicians to actually design clinical trials, and then goes out and make sure that individuals who are minorities are able to get into the clinical trials. We're very proud to be a primary partner in that, but we're also doing other things like the Cancer Disparities Progress Report that really highlights the needs in certain areas. That was something we started a few years ago, and it is something that the lawmakers are interested in as soon as it comes out. So I'm very proud of that activity, as well as other things that we're doing to help minority investigators.
And we do an awful lot of work in Washington, D.C. with the FDA and with others. Could you just elaborate a little bit more on that work?
Well, I'm very proud to say that our organization is the most active within FDA in terms of working on areas that really need attention. For example, there's one coming up called the FDA AACR workshop on overall survival. It not only has 200 people in person, but there are over 2,000 people online who have actually signed on to be part of this workshop. This is just one example of several things that we're doing along with the Food and Drug Administration. And it's thrilling because regulatory science and policy is a strong suit of the AACR. With the best scientists that we have in the world and in our membership, we can help FDA, and FDA will then be able to facilitate the approval of important therapeutics for cancer treatment.
So why do you think we're called the honest broker?
Because we're honest. but I mean, I think because we are an organization that relates to various sectors, and we can be the catalyst for activities. And we are always careful about making sure that we're not involved in conflicts of interest. And to my mind, it really works. It's thrilling to be able to do that for the field.
So we're getting ready to launch a new strategic plan for the organization. And I know this is a really important juncture, for us. Why is this so important for us, and where do you see the AACR going?
Well, I think that, first of all, because we are the brain trust of the field, we absolutely must always be thinking ahead of the curve. We cover all the sciences from laboratory research all the way to the clinic, and now we're being asked to actually also make sure that our work gets to clinical practice, which is something we haven't done before.
Right.
So I think we're being encouraged to really work on that, and that has to be part of the next strategic plan. But most importantly, looking ahead to how we can address the field, there's always new opportunities going forward. Having so many talented scientists in our organization to think through what we need to do as an organization is extremely important. We are now working on the development of a scientific advisory council that will report to the board of directors on the most important future opportunities ahead in the field. And so that to me is a very important part of the strategic plan. But there are other aspects. How much do we need to focus on education, training, and keeping and the professional advancement of young investigators? Where do we want to do our meetings? How much can we offer abroad in terms of our meetings? And of course, every aspect of our business, whether it be policy or science, needs to be examined. So I think the strategic plan will be very important in addressing all of those issues.
It sounds like we're going to have to raise a few more dollars also to
You
meet
will
the
do
needs
that.
and an important very important part of what we have to get accomplished.
Absolutely. I mean, all of these, whenever our scholars get together and start talking about what needs to be done, they immediately, it immediately triggers the need for more funding. And I know that you'll be able to do that. I know that you're going to do that, Mitch, because you're a talented fundraiser.
So thank you very much. To the audience, Dr. Foti was right there front and center at the inception of Stand Up to Cancer. We are the scientific partner of Stand Up to Cancer. Could you just chat a little bit about Stand Up to Cancer and its importance and why we play such an important role in that organization?
Thank you. Well, in 2006, I got a call from Sherry Lansing, who was the former head of Paramount Pictures, for us to be the scientific partner of this important new activity. And the organization was founded by a number of women who were very passionate about this field and the desire to really address cancer in all of its forms. And so we were asked to be the scientific partner, and we were activated almost immediately. And actually, they are about to have a 15th anniversary telecast in August of this year, where we will be honored as a scientific partner. Clearly, because we are the brain trust of cancer research in all the world, our ability to provide scientific credibility to what is being done, to provide advice on the scientific advisory committee, to be able to oversee all their clinical, all their grants administration, is absolutely essential to their success. And so we are very honored to be part of it, and we are currently talking about extending our relationship into the long term.
That's great. That's awesome. So ladies and gentlemen, if you were ever considering investing at the AACR, after spending a few precious moments with the Chief Executive Officer of AACR, how could you not make a donation to the AACR? Dr. Foti has mentored many people. She's mentored me, and I really appreciate your support. She's a strong leader, but she's a visionary, and the AACR is in really, really good footing. But, we both agree that there's a hell of a lot more to do. And there's urgency out there and a need to fund cancer research. I just really want to thank you today for spending a few minutes with us. It's been a true delight. Any last thoughts you would have today?
I guess my last thoughts would be that as we look to the future of what our organization is doing, we must continue to realize that with the 200 different cancers out there and the complexity of cancer, that we must continue to be fresh and innovative in what we do, and we can only do that with appropriate funding. So I'm hopeful that the public will consider that and look to us for major donations to our organization, because I know that these precious funds, will be used for the very best science going forward and save lives from cancer.
Well, Dr. Margaret Foti, thank you so much for participating in Believe in Progress.
Thank you.
Once again, thank you to our listeners, supporters, and donors. Remember, your support drives the progress against cancer. Once again, please consider subscribing to our podcast, sharing this episode with a friend, and heading over to our website, aacr.org, to consider making a donation. Thank you for listening to Believe in Progress, the AACR podcast. This podcast is produced by CollegeCast LLC. Please visit www.collegecastpodcast.com for more information. And don't forget, cancer research saves lives.